Please have a seat. We have arrived at the end of the conference, of this conference, EHMA 2025. Please have a seat. And I thank you so much for your participation and involvement throughout these intense 3 days. We would like now to recognize the great research presented during this conference. And for this, let me introduce you Professor Pamela Mazzucato, who will present the EHMA and Karolinska Institute Medical Management Center Research Award. Pamela, the floor is yours.
Yes, thank you so much. So I'm co-director of the Medical Management Center at Karolinska Institutet, and we have collaborated with EHMA for many years now, and we want to particularly highlight the contribution of young researchers in the field of healthcare management by giving this award for the best contribution to the field of healthcare management in the context of a PhD thesis. So we had actually a long list of abstracts that were submitted. I think there were over 30. And we had a short list of 6 abstracts that participated to the PhD session yesterday. They all presented, and I think I would like you to give an applause to all of them, because they were all very high quality work. But of course, we had to choose a winner, and there was a jury composed by me and 3 other colleagues. And we decided on the winner of this year, Karolinska Institutet EHMA Award is Dr. Rafael Kermaydik, who will just congratulations. I'll give you the prize, some pictures. Yes. Yes, this is for you.
Thank you very much.
Yes. And this is for you.
Thank you very much.
And you will have the chance to present your, I mean, one of the, these presenters were all very good. They all managed to present their thesis in 10 minutes. Now we've asked Rafael to do it in 5 minutes. And I just want to say that we chose your work because of the novelty of the topic, environmental health challenges, how we prioritize by socioeconomic cost as a tool for decision-making has been a topic that has also been very much highlighted in this conference, sustainability, for the novelty of your work, but also for the humbleness in which you presented it. Research tells us a lot, we learn a lot, but the more we learn, the more we find new questions that we need to answer, and we look forward to your upcoming research. So, welcome.
Thank you very much. Well, thank you very much. I'm not used to this exercise. First, I'd like to thank, the Karolinska Institute, EHMA and EHKSP. I'd like to thank also my small team of research with my director of thesis, Cyril Arpe, and Noé Mao, who couldn't attend today, and also Marine, which is with us today. So I've had the privilege to try to narrow it down to 5 minutes. So I'm working in a small team working on the ecological transition of the healthcare system, and my approach was through trying to prioritize environmental health challenges through their socioeconomic cost. First, as a tool to decision making, and also support the ecological transition of the healthcare system. So first, for the quick context, we know that the health is connected to the quality of the environment, and about 70% of non-communicable diseases are linked to environmental factors. We also know that climate change is impacting all the compartments of the environment, and therefore is going to impact and is already impacting health. On the other hand, we have the healthcare system that is taking care of these health issues, but is also impacting the environment through waste, air pollution, and also GHG emission. And here in France, we estimate that the health system is responsible of around 6 to 8% of national GHG emission. So from this context, the objective of the first part of my thesis was to conduct an analysis of the environmental health challenges through what we call the environmental health determinants and try to prioritize them through the socioeconomic cost as a tool to policy making and the health, support to healthcare system ecological transition. The broad research question would be, what is the weight of the environment on the society and the health system? So I'll go quite quickly on the method, but just to give you an overview, so I went through a scoping review first to select all the environmental health determinants that we wanted to study, because the definition of environmental health is so broad that not all the sources and documents are analyzing the same aspects of environmental health. So we crossed different grey literatures and academic sources and ended up with a lot of discussion selecting 9 main determinants of health, and their subdeterminant would be the main factors or pollutant inside those main determinants of health. We kept also, of course, climate change and biodiversity loss. Then I collected lots of general data on a national scale, being main sources of emission, mean of exposure, sensitive population, environmental impact, and short and long-term health effect. And then I collected all the associated costs. So all the socioeconomic costs are composed of health-related and non-health-related costs and can be direct. So that would be, for example, health expenditure and productivity loss. Or material damages linked to climatic events, for example. And most of the cost of the socioeconomic cost is actually indirect or intangible. That would be the valuation of premature death or years of life lost, for example, or the loss of well-being or ecosystem degradation. And that leads to a global socioeconomic cost. And then I aggregated those costs depending on if health effects were independent or interconnected. And I ended up with this diagram with blue in lowest being the lowest estimate and orange being the highest estimate depending on sources and methodology that are being used in those different sources. And it turned out that the main environmental factors weighing on society would be noise, 147 billion euros per year, including annoyance, sleep perturbation, obesity, mental health, for example. Second one would be outdoor air pollution, costing up to 130 billion euros per year, but this time accounting only for the valuation of the 40,000 premature deaths linked to PM2.5 exposure, so not the same parameter for the cost included. And then third one, a bit a tricky one, nutrition and physical activity, with overweight cost and obesity costing between 20 and 27 billion euros per year, and sedentary lifestyle and physical inactivity up to 140 billion euros per year, this time linked to 38,000 premature deaths per year and 62 associated pathologies. The trick here is I couldn't identify the attributable part of this cost linked directly to environmental factors. We also know, of course, that there's also behavioral, sociocultural factors that have to be taken into account here. So main limit being that all those results are tributary of available data, and I've been looking where others have been looking before me, and they've been looking where we have the tools and the knowledge to do so. And there's a lot of challenges ahead, especially regarding, for example, the quantification of biodiversity loss, climate change, or, for example, multi-exposure to chemical agents. So this prioritization might change with the evolution of science. The costs do not take into account the same parameter, nor for social and environmental inequalities in health, which is a major issue here, and does not take into account neither the increasing cost of climate change and biodiversity loss. What it does give is an overview of environmental issues and the socioeconomic burden of environmental health determinants, could be a potential tool to decision making in environmental public policies. But the real question that was actually asked during my first presentation is a perspective: how does it translate into actual public policies implementation? And that has been the part of my work during the rest of my thesis, trying to analyze how cost is only a small part of the argumentation that we can have to implement efficient public policies. And we have to go through sociology of environmental public policy to understand all the other factors, being political factors, geopolitical factors, socioeconomic and lobbying activities and so on, to understand how a public policy is implemented and efficient or not. Thank you very much for your attention.
Okay, it's still time for reward. So I would like to call on the stage the president of the EHMA Board of Directors, who will present the other awards for Best European Paper, for Best Non-European Paper, Best Poster, and People's Choice Poster. Anthony, please.
Thanks. Okay, we've been 3 days here. It's been highly satisfying for the friendship, for the connections, for the presentations. We've gone from Moldavia, where we were shown the workload of people caring for their elders, to Ghana, where they explain about the immunization of people in remote areas, to discuss about the bundle payment, or to be surprised about green hospitals. But there have been much, much more that I cannot recall all now, of course, and some have been selected as to be awarded. So, the ones to be awarded, first of all, the award for Best European Paper. We have 5 shortlisted papers that, as mentioned before, all of them might have been awarded, and an applause for all of them, please. And the award for Best European Paper goes to Professor Odessa Dariel. She says she's not.
I'm not Odessa. But she works in my team, and unfortunately she left to go back to Paris. So I would like to thank the scientific committee on behalf of Odessa. I'm sure she will be very happy and proud, and especially because it was her first attendance to the EHMA conference, and I know she enjoyed it, so I'm sure that now she will come every year. Thank you.
Then we have also the award for the Best Non-European Paper, and we have 2 shortlisted papers. And the award goes to Cheryl Chong Ziya. Seems she's not here. So we have also the Best Poster Award. In this case, we don't have a short list. This year's winner is Marija Jevtic of the University of Novi Sad. And finally, this year, we also have the People's Choice Poster Award, and the winner is Laura Jiménez Jordán. Consorci Sanitari al Penedès Garraf. And we are already thinking of 2026, and I think that we'll have a surprise now. And let us know.
Hello everyone, this is Rosa Vidal. I'm the Economic Affairs Director of La Unió, an association of healthcare and social providers from Catalonia. And I'm here today because next year La Unió will be hosting the EHMA conference in Barcelona. We hope that we can see all of you there. We will be waiting for you. And in order to achieve this great opportunity, we would like to thank to the REMS team, because these days we have been learning a lot of things about how to put in motion a success congress. So we are really, really happy of co-hosting this event last year. And the following weeks and months, we will be sharing details and more information with you. But for now, please book and block your agenda about the second week of June 2026. We'll wait for you in Barcelona. So see you there. Thank you very much.
And so, of course, inviting all of you and your colleagues to come to Barcelona. I'd like to thank everyone. I'd like to thank every speakers who have participated, all the participants who have helped to be even more interesting each session, all the sponsors that have helped us, helped EHMA. And I wanted to thank especially the EHSP, thank Catherine, of course, thank Isabel, thank Olivier, thank Fanny, because it's been a very warm 3 days that you have helped us to enjoy here. It's been really, really nice. You did it. Can you come please to the stage?
Okay, thank you very much, Anthony. On behalf of the EHSP, I will thank EHMA team to have trusted us to be able to organize this conference 2025. I wish to the Barcelona team all the best for preparation the conference 2026, and I also thanks everyone for being there, for helping the EHMA team, the EHSP Dream Team for co-hosting. And while it's time to go back to home, and I wish you a smooth and safe journey. Bye bye. See you next year, maybe.
Isabelle Richard. Is Isabelle? Ah, there she is.
Okay, so that's all. Merci beaucoup. À bientôt. See you next year.